My name is NICOLE MASI, teacher John MOSCOSO. A 40-year-old boy with severe combined immunodeficiency presented 3 times to a medical facility over a period of 4 months with fever and a that progressed to hydrocephalus and status epilepticus necessitating a medical induced coma.
First of all, patients like high-end medicine. They like the buzzword individualized therapy, which we've used for quite some time, which now really turns into reality. We're not just talking about individualized medicine anymore, we're utilizing it. When I talk to patients, normally I talk about chemotherapy, one size fits all. When I talk about the gene panel test, I actually try to find out what really drives your cancer. What is specific of this cancer, of your cancer compared to other cancers, which can help us make treatment decisions. Off-label, but rational off-label use, not just empiric, but targeted toward patient mutations. Are there any mutations which really drives biological?
Application in medicine. Diagnostic work includes brain biopsy, watch, underbelly, biset next generation sequencing of the cerebrospinal fluid, identify of sequencing rates corresponding to leptospirosis infection. Clinical assay for leptospirosis were negative. Targeted antimicrobial agents were administered and the patient was discharged then selected with a status close to his premorbid condition,
etc. So we try to use pathway inhibitors based on. So when we started discussing what kind of gene panel array and what kind of panel actually came from the practicing oncologist who actually sees patients. So there was a back and forth, an integrated process between laboratory and not to create too much noise. Because the problem that I see with some of these, let's say, extended gene panel testing, it creates a lot of information that bears no clinical relevance. And then it leads to misinterpretation. So the integration of this gene panel test into clinical
pros and cons. Polymerase change reaction and serologic testing and at the Center for Disease Control and Prevention. Subsequently confirmed the evidence of leptospirosis Santarosis infection. The patient patient medication included multi-infection of intravenous immunoglobulin 4, hypogammaglobulinemia, and trimethoprim sulfamethoxazolate or atobanks for prophylaxis against pneumocystis jirovecii pneumoniae.
So we've been using the next generation sequencing platform in our research. So as we further our work with next generation sequencing, again, we're seeing the biology of the disease in a way that we've never seen it before. We're uncovering more and more genes that are these good and bad actors in cancer, and and certainly we're going to use this platform to just to enhance the quality of treatment decisions for patients with cancer.
Confirmatory testing for leptospirosis, primer targeting the genes amplio A and C were designated directly from the mapped next generation sequencing range and the identification of leptospira was confirmed 5 days after the next generation sequencing analysis, which the hours of analysis and Sanger Sekeli supplementary.
Mapping those DNA sequences for the unimaginatively a competing private effort started by Craig to the structural elements of DNA, like at the tips and middles of chromosomes, or haplotype mapping project. The primary goal is to identify what gene variants are involved in different